What an amazing start to our conference. And I think the story they tell shows you how much they've been enriched from the learning they've gotten at UNC and Duke, but what it doesn't tell is how much we've been enriched, and our students at both institutions are enriched by having these amazing fellows within our program. So just acknowledging how much they contribute to our learning as well. So I'm going to moderate today's session. I want to give a little bit of an overview or my synthesis of what we just heard, and then I'll open it up with a question and then open it up for the audience. So collectively, these 4 presentations ask us to really reconsider where peace, health, and stability begin, and where they often quietly unravel. Across very different contexts, from North Carolina farms to early childhood development in Ethiopia, from conservation policy in Uganda to zoonotic disease outbreaks in Ethiopia, we see shared roots of the problem. The most consequential drivers of conflict, suffering, and instability are often structural and preventable. They sit not only in moments of crisis, but in the systems we build, the policies we put in place, and the communities that we do or do not include. Our fellows in this session highlight distance as a central theme, not just physical distance from care or services, but moral and political distance, decisions made far from the people who really bear the consequences. They also challenge us to confront the blind spots. Early childhood, indigenous rights, local health systems, and human and animal environment interactions that sit outside the traditional peace or development frameworks, yet are really fundamentally shaping whether societies experience peace at all. What binds these presentations together is a shift from reactive to preventive thinking. Peace here is not framed as the absence of war, but is really built early, built locally, and built with people. Rotary's emphasis on service, prevention, partnership, and long-term impact is evidence across all 4 of these talks. They collectively challenge us to ask not only where Rotary funds or supports, but how early we fund, with whom, and according to whose priorities. They invite us to see peace building not as abstract diplomacy, but as something that must happen through investments in people, systems, and communities long before conflict ever becomes visible. So with that, I want to open it up with a question that I'm going to ask each of you to respond to briefly. We have only, I want to make sure everyone has a chance to ask questions. So, but I'll get us started with, many of you highlighted the consequences of exclusion. And so I want to ask you, from your experience, what really characterized genuine inclusion? And what are the risks when systems move forward without it? So in the context of your talks, what really characterizes inclusion? And what happens if we don't have that and move forward without it?
Well, thank you. Been an excellent question. Thanks a lot. Inclusion, exclusion is when you fail to involve the lowest stakeholders in decision making, meaning that they are completely not part of whatever decisions that a particular government or organization is making. Like in the case for Uganda, when you don't involve the least, the grassroots, as part of the stakeholders in the conservation, completely you have knocked them out, and they will always be the one to face the consequences. Thank you.
We have a new way of using the mics, so. I think sometimes we talk about inclusion or exclusion as well. We talk in very rhetoric way, but to simplify things, if you don't include everyone, you are harming yourself. Let's take an example of protecting people from disease. If you think that by, for example, vaccinating 2 or 3 of those who have access to immunizations, for example, but there are people or communities excluded, you're not protecting yourself. So you have to include them even if they are not on your budget, for example. So to be very pragmatic, even if you don't care about these people, even if you don't want to help these people, if you want really to help yourself, you would include everyone on board. So everyone gets a chance and you will be protected as well. So it's very important to include everyone first because of you want to ensure welfare for everyone, but at the same time to be very pragmatic if you want to be, and include everyone for your own safety and for your own self, whether it's community-based approaches, whether it's farms, whether it's diseases, everything. If you want to reach everyone and protect yourself first.
Thank you for that question. I think it's really important, I think for me, especially I would say when you talk about inclusion, it usually comes with some sort of feature. It has to be like a human being or some community members or a place. And I feel like time has been really invisible when it comes to peace building, because when you talk about peace building, we always think about these big things that we see, these huge agendas that are crafted for many, many months for any UN or AU meetings. But then again, when you think about it, it's the people that are actually sitting there that are doing these huge decisions, who have never had the same kind of experience that we want them to do, for them to have that empathy, that trust, for them to actually be able to have those discussions and then have a room of negotiations. And I feel like that has been excluded from our interventions. And the more we do that, the more we bring people in, the more we let them have the trust and the empathy in them, they would be open for any kind of compromise, any kind of conversation. It will always lead to some sort of connection, some sort of goal, and how I see that.
Thank you. For me, I think I see inclusion at the systems level. In my context, like organizations working for peace and development, and not only public health, actually have different priorities set. For instance, healthcare setups, they have patient outcome as their major priority. Let's say veterinary medicine, they have, their animal health as a priority, or agricultural services, they have their priority to improve food safety or like improve their system. So each organization and each system has their own priorities set. So for me, inclusion means to design a policy that can actually help coordinate the systems and design a policy to help fight the barriers of working in collaboration. For instance, there are various policies that hinder easy data sharing, privacy issues. So we can have a system that allows integration of data that makes the environment or like the working situation easier for collaboration and for better outcomes. And that's how I see inclusion, like designing a way to actually have different systems to work together.
Well, thank you. Let's open it up for the audience now to engage with these scholars. And please, if we can get the microphone, I see it right here in the middle. Pass the mic.
Hi, real simple question that won't be easy to answer. What is the number one aha moment, your biggest takeaway from this entire experience?
I'm going to start that. Yeah.
I think in this 2 years, the biggest thing that I learned is to be able to think in systems. It may sound like I'm repeating myself, but it is really the major takeaway for me. Before I came here, I used to think like to improve public health, for instance, I would only need to improve the hospitals or like train more professionals, or, you know, just focus on healthcare. But that doesn't take us anywhere. That doesn't get us anywhere. We need to improve the surrounding and like the environment that actually enables us to actually bring about change in sustainability and like long-lasting peace and development. So to be able to think in system is the biggest takeaway for me. And they taught us really good on that too. So
I think for me, the biggest takeaway would be, so before coming here, I did work with a lot of NGOs, and a lot of my time was like fighting on policies. You need to have these policies, you need to have these. At some point, I decided that maybe I should go there and you know, learn a lot of policies and how it's been built. And I came in and I actually understood like, we're actually really, really late. Like what we do, what we are building, what we are crafting, that is actually late. And when you go into everything that we have right now as a policy, as a strategy, you could call anything. It could be peace, it could be food security, it could be nutrition, it could be anything. When you look at it, it's a lot late. And the problem that I'm seeing is, again, with the whole inclusion, it's a very good question, is nobody thinks about time being excluded. Like we always think about people or place. And I wanted to bring that into people, that time can also be excluded. So we need to think about that. Should be part of that list, that we have a long list of excluded things that we always talk about, always think about. Time has to be included in that as well.
For me, when I moved from Yemen to the US and being here within the triangle, and every time I move between my house to the School of Public Health, I see the big, beautiful hospitals, the UNC hospital, and we have the Duke Hospital here. I was like, wow, this is America. This is the United States. And I should learn from how they manage things and how they build big hospitals. They have bright minds, great doctors, great services. But the moment I went to rural Western North Carolina, I was like, wow, this is Yemen. So first I was thinking I should learn from here, but then I was like, they should learn from us as well. So that experience was an eye-opening one, that we should share experiences because we have so many similarities. We are good at something, people, different places are good at something, we share knowledge, we try to make good in this world. So that was the very eye-opening moment that I realized that things can be different within the same country, within the same state, one of the wealthiest countries in the world, and yet you see some exclusions in these communities. So that was the eye-opening moment for me.
For me, actually, having worked with refugees for several years and now working as a civil servant, there is something that is missing. The people we intend to be serving are always not heard. So my takeaway is, whenever there is an intervention, even with the Rotary-related projects, the people that you are serving might be suffering silently. I have been in Uganda all my life, and this is my first time talking about displacement. I have been in the sector actually contributing to the displacement, but I could not see it. Now it is because I am here and learn a few things. I am now here talking, oh, displacement. But I have been there they facilitate displacement. So I think the biggest takeaway is the people that we serve need to be heard, whether it is vaccination, whether it is environmental, whatever, all the people actually have something to share with us. Who seems to be helping them? There is one thing they always have that they can share with us. Thank you.
Thank you for your amazing presentations, thought-provoking. I'd like to ask your advice for those of us in the room. Rotary International and individual Rotary and Rotaract clubs have a platform. How can we better use that platform to highlight what may be invisible communities? I think one of the key threads through all of your presentations, you were dealing with invisible communities or communities who had significant access barriers, both to power structure, to goods and services. How can we better use our platform to help highlight those communities?
Well, thanks a lot for that excellent question. Just a few, before we started this presentation, I was interacting with one of the Rotary members. And I was telling him that the area that I come from doesn't have a Rotary club. And now that I am a Peace Fellow, a Rotary Peace Fellow, there has been pressure building up on me that when are you finishing? Come and what? And start a club in our what? In our district. So I think we have looked at meetings as the only point of interaction and sharing Rotary values. But I think actually having a platform. I know there is an alumni platform where they always meet once, but we really need a platform where we place there our specific Rotary Club views and challenges that we go through. I think there is need really for maybe, I don't know whether Rotary International can open like where we can like a website where there is a dashboard where districts can place their opinions and challenges. I think that is really something that will keep us up to speed and also enable us to learn from what other Rotary clubs are doing. Thank you.
Having worked with the International Committee of the Red Cross, we had one of our main themes within the health department was to make the invisible visible. So don't wait for it to come to you. Don't wait for people to voice out their concerns. Go to these communities, take the clinic to them, take the services to them, take the microphone to them. Don't think that people will come and grab the microphone and speak up, make a noise or something like that. Some communities and in some traditions, people need to be invited because of so many years of being silent, so many years and decades of being excluded, so many years of, they think this is the norm. So when you go, break the silence, you go and give them the opportunity to talk, give them the opportunity to be seen, give them the opportunity to be visible to the system. You take the system to them if they are not able to come to the system. As we saw, 80% of farm worker families, they don't have transportation, for example. So what's the solution? We take the system to them. We take the auditorium to them. We take our media platforms to them. So it's a two-way stream. Please don't expect people, because there is a hospital, people will come to it. Because there is a school, people will come to it. You need to go to them, to reach them, because they think so many times, people think the normal is to be excluded and no one would hear. Yeah.
I think I would say, since there has been an aha moment for me as well, like to see time has been also excluded. that awareness has to start. That could happen in anywhere. Like it could be your clubs that you would do, like club meetings. You can invite people to actually let them know, have the awareness that time can also be excluded, and we have to start doing early. And I heard an experience from my host family, Lisa and Jeff Higginbottom. I think last week we had a dinner together, and they're telling me about the McDonald house that the Rotary Peace Club, the Lisa is managing, is now planning to work with them in making sure that there is safe place for mothers that come from far, a lot of them states, for them to have a space and a food and a place to stay when they are, with their kids, when they're going through different kind of treatments. I mean, it could start in those small things, in small places. But I would say the first thing is creating the awareness for them to know that has been a problem in our system, and you need to know about it. And when people know, I'm sure they will act.
So in the past 2 years, I've been to so many Rotary clubs. I've given presentations. I've heard so many presentations there too, mostly like global grant project reports. So I would say, even though the question is really tough to answer, I would say when you do like global grant project reports, focus on the people, the stories, and not just the number and the money spent and the outcome and the actual magnitude of change. I would say like we should pivot more to the personal stories, the lives we touched, the individual lives we touched. And Rotarians are all over the world. There are millions of us, I can say, but now I'm almost graduating. So that's a lot of clubs worldwide too, with numerous global grants. And that's thousands of lives changed. So we can use our reports to tell their stories, highlight their stories, highlight those communities, in addition to the Rotary Peace Fellowship, which every year takes in 10, 11 students. Each come from different communities with different stories to tell. So I talked about one story today, but I have so many others. So keep doing the Rotary Peace Fellowship. Also, the global grants are excellent, but the storytelling should be emphasized, I think.
Okay, my eye was caught by maybe our youngest audience member who has a question I see here. So this is our very last question, and then we'll break for coffee. Yeah.
Good morning. My question is, I saw in one of those slides for Uganda, I saw one of the men, like they were defending the place, the parks, but why would they stop their own like brothers in blood from going to the park? Like why would they kill their own brothers?
Sorry, while you are there, can I add one more question? Oh.
Thank you for that very, very good question. You see where the world is moving. All eyes of governments actually looking at resources in terms of money. So at this point, they have discovered that there is money in conservation. So they are doing all it takes through policies and through the military, ensure that these resources are protected from human interaction. So the value is actually they are looking at the money. In terms of what we have mentioned here, climate change, carbon, you know that the forest takes a lot of carbon dioxide. So the polluters are looking at that okay, let's give some of our money to these people so that they can conserve the forest, so that the forest can capture carbon dioxide, which is a big contributor to climate change and global global warming. And secondly, these same conservation areas provide employment. So the government will look at you, one person, or you, a small community like mine, we are just about 15,000. Say, this community is actually contributing very less to the what? To the economy. Why can't we just drive them out, since we are expecting thousands of dollars from this environment? So that is actually what is happening. The government is driving people away, ensure that this area that is a contributor to the country's economy is preserved, and that has been really the case. But what we are advocating here is, why can't it be inclusive? Why can't human beings, they have been interacting with these areas and they have been surviving? Because that forest is their source of livelihood. Like the case we have pointed in Zambia, there must be interaction. But here, because they're using extremely exclusive approaches, that doesn't really allow human interaction. That is why I am here today to say, please, using your Twitter handle, Facebook, whatever it is, just type there, respect the rights of indigenous people. Forests is their source of livelihood. And researchers showed that communities that benefit from the forest seldomly destroy it. People who destroy indigenous people's forests actually come from outside. So instead of the governments and policymakers focusing on those outsiders who come to invade this forest, they are now looking inwardly. And I think it's something that got to change. Thank you.
I think with that, we'll go ahead and close this session and invite you to coffee. I know there are a lot more questions, but John pointed out there's a box. You can drop them there or find these fine scholars at coffee. Thank you.